Hey, welcome to How It's Done, a podcast for curious marketers. I'm Christy Goad. I'll be your host, and I'm really glad you're here. Today, we're here with Alisa LaPolt, and we're going to talk about the role of storytelling in mental health, because mental health is a top subject. It's kind of on the top of everybody's minds. We're coming off an unprecedented, is the word everyone likes to use, year of trying times and completely a lot of upheaval, a lot of things that none of us could have ever anticipated nor would have wanted to have to live through. So Alisa is Policy and Advocacy Director for NAMI Tennessee. NAMI Tennessee is the Tennessee chapter of the National Alliance on Mental Health. Welcome, Alisa.
Thank you. Glad to be here.
It's great to have you. Let's start by you maybe just telling us a little bit about yourself and how you came to work with NAMI. What brought you here?
Sure. So I've always had an interest in mental health policy and policy work. And as you know, I used to be a newspaper reporter.
Yay!
You and I worked together back in the day at the Nashville Banner. And I kept on with my reporting career after the Banner and got into a lot of healthcare reporting, Medicaid, just health policy and how it affected people. And then I just started noticing mental health wasn't talked about a lot in state government. And I paid attention because
really the place that should be talked about a lot, let's be honest.
Exactly.
Anybody as a reporter, especially that's ever covered government, knows how true that is.
Yes, which we both have, because I replaced you after you left covering the Sundquist administration.
You did? I totally forgot that.
Yeah. Mm-hmm.
Man, that was fun. I loved covering politics as a reporter.
I did too.
Really, I mean, I think a lot of people forget that politicians are people too.
Yes.
But when you're in it, you get to know these people as humans, and you realize that they are people too, and they have, real lives like the rest of us, and they actually give a lot of themselves and give up a lot on their personal lives to be able to serve. And I think that gets lost a lot of times. But
yeah, I agree.
Little tangent.
Yes. So I eventually switched from reporting to lobbying in 2003, and
the dark side.
I would say the darker side from where I was. I was already there, but and I just started focusing on again mental health, healthcare work. And then I became the executive director of NAMI Florida, the National Alliance on Mental Illness, Florida. And
when was that?
That was in 2016. And okay. I spent 2.5 years in that role. And then during that time in Florida, we had the very tragic shooting in Parkland, Florida at the Marjorie Stoneman Douglas High School. And it took a crisis like that and 17 people getting killed for the Florida legislature to finally do something. And it was a shame that it took a crisis to happen, but I was instrumental in getting legislation passed that mandated mental health awareness programs in schools.
Wow.
So it became top of mind for legislators. And it was really interesting to see everybody pulled together in that crisis. You had the legislative session was already in progress. So you had advocates like myself coming together to come up with proposed legislation. How do we prevent this from happening again? You had legislators scrambling, and then you had the whole gun rights thing, and then the mental health thing. And it was just, it was emotionally draining, but the final bill that passed was really good. And it was just really rewarding to be part of that.
Wow, I bet it had to feel like such a sense of accomplishment.
It did, and at NAMI we have a lot of really great programs, including one called "Ending the Silence," in which we have a trained presenter, a young adult, and an adult who have lived with mental illness, and they go in and they speak to middle school and high school students about the stigma and about the concerns about talking about your mental health problems and depression and sadness. And it just makes it easier to talk about. So that's one example of the really great programs that we have at NAMI.
Well, I mean, I think that ties back nicely to our topic today, the storytelling, and its role and place and really power in mental health. I'd love for you to talk about what that means to you. I know you and I, in our advanced conversations, you had a lot of great things to say just about the whole notion of authenticity and the role of authenticity in storytelling and mental health. Can you talk about that a little bit and why that is so important?
Sure. So in my role as policy and advocacy director, my job is to teach people how to tell their experience with mental illness to policymakers, legislators, decision makers. And it's important that people understand the journey and that recovery is possible and hope is possible. And if I'm going to be teaching people that and asking them to tell their stories, then I need to be able to do the same. And, I talk very openly about my sister who passed away from, I would consider, medical complications from drug abuse. And she had mental health problems, mental illness. And she passed away in 2016 while I was at NAMI, Florida.
Yeah. Wow. You had just started there, huh?
Yeah. It was like just a few months after I started with NAMI, Florida.
Wow.
In fact, I found out about her, when she had the brain aneurysm. I was at a NAMI conference in Denver. So it was just pretty jarring. And then she passed away. And then her oldest son, my nephew, who, when he turned 21, he decided to end his life and shot himself. So,
wow, that is so tragic. I'm so sorry.
Yeah. And well, thank you. And they both lived in Greene County. And so my nephew became a statistic. So I decided to move back from Florida to Tennessee. And then this job opened up. And it's just really important for me to say why I up and moved to come back home, because I don't want any other young man or young woman or anybody to feel like that's the only option they have. And so it's important for me to tell my story so that other people can feel free to tell their stories.
And I would imagine that gives you an awful lot of credibility too, when you're going to talk to the Tennessee legislature, right, about different policy or law, anything that we could pass to really help address some of the problems that exist with mental health. Do you find that to be true? Because they know it's not just a job for you, right? You really have a lot of emotional investment, and there's a reason you're so passionate about it.
Oh, definitely. I mean, I think it's important to walk the walk and talk the talk. And it's very interesting, my time here and in my time in Florida, it's interesting what legislators will say behind closed doors. They will share with me their experience with mental illness, whether it's they themselves or a loved one, a coworker, a neighbor. Mm-hmm. And a lot of them are just afraid to talk about it publicly because they don't want to be judged, because that stigma is still there.
Right.
And I would point to the governor as a great example of somebody who does speak without the concern of stigma. Mm-hmm. He talks frequently about his daughter's attempts at suicide, and as a father, not knowing where to go or who to turn to. Wow. And in fact, we just gave him the NAMI Tennessee Advocacy Award for his proposals last year on like a mental health safety net for children and more funding for mental health. And of course, most of that got rolled back because of COVID, some of the financial concerns there. But he's an example of somebody who talks bravely and openly about it, and it makes it easier for other people to do the same.
Have you noticed any kind of ripple effect from that, among people here in Tennessee, other legislators or other people, within state government? What
I've noticed is people calling and asking for help and like how to talk about it, because they're it's so awkward. Like a lot of times people don't know what to say after a suicide. Like, what do you say to the parents and to the family? Mm-hmm. I have gotten calls from people asking for more talking points on, and they want to know, what is it that we're going to be doing legislatively this year. So there's more inquiries, and certainly a better understanding about the need for mental health services because of COVID and the pandemic and all the mental health challenges that's presenting.
Absolutely. I think the numbers are that the pandemic and the resulting recession and all the notable effects on mental health, that the figure's something like 1,000% increase in calls to the National Suicide Prevention Hotline, which is just astounding, but not surprising, really. And then also 90% of employers have indicated that COVID-19 has affected their employees' behavioral health, and that they're taking a closer look at how to recognize that, how to provide, resources and benefits, quite frankly. Have you seen that be the case? I know that you mentioned you get calls. Are you getting calls from companies and corporations around this topic?
Yes, we definitely have, especially right when all this hit. So I do want to mention that even before the pandemic, the number one cause of worker disability in the United States was anxiety and depression.
Wow.
Right. So a lot of times you'll see employees like a lot of absenteeism or what's called presenteeism, where they're working, but they're not totally present. They're not producing because they've got underlying anxiety, depression. And so that was already a dynamic in place before the pandemic. Now it's just spreading to more people. The numbers are getting bigger. Another statistic that I find interesting is prior to the pandemic, 1 in 5 individuals in a given year would be affected by a mental health condition. And those figures are now 1 in 2. And that's from a CDC
Are you kidding?
report. That's according to a CDC report over the summer. So we've got 1 in 2.
What do we do with that? Seriously.
So, my recommendation is that we really focus on wellness. And just because you have anxiety or depression does not mean you have a mental illness. And I think it's important for people to understand the spectrum of mental illness, just like you have a spectrum of physical illness from the flu or a cold all the way to cancer. Okay. That's still a physical illness. So mental illness can actually be just anxiety and depression all the way to bipolar disorder or schizophrenia. It doesn't have to be a mental illness. Like, in other words, there's situational anxiety, there's situational depression after a death, anxiety because of a project or something at work. But when we start seeing the symptoms affecting your daily living for more than 2 weeks, then it becomes a mental health challenge. So I think it's important for companies to recognize that we all have mental health conditions and challenges, and to make it more mainstream in conversations around the workplace.
You had mentioned that you have even created, I guess, a playbook, if you will.
A toolkit, right.
A toolkit for companies. Talk to us about that. And I think you also had recently been called on by HCA.
Yes.
Here in Nashville. What did that look like? And what are the kinds of things that are involved when you're helping employers think about this? Sure.
So HCA, I was really pleased that they reached out to us. They have like a series that they provide for their employees. It's, like tackling difficult subjects in the workplace. And this was one of them. And it was in May. And they wanted to focus on mindfulness and the importance of staying present and not worrying so much about the future. So, we kind of talked through that, and they wanted their employees to understand the signs and symptoms of what a mental health challenge looks like. They wanted reassurance that just because you're going through this, that it's not necessarily mental illness. And also that this pandemic is new to all of us, and it's presenting a trauma. This is, in some ways, a lot of us are affected by this traumatic event.
Well, and especially for a company like HCA, healthcare, which is on the front lines all across the country. And
Right.
we know for a fact that the effects on mental health and mental well-being and physical well-being for all of our hospital and health system providers is just huge. And, we probably don't even know what the full lingering effects are going to be.
Right. Definitely healthcare workers, those frontline workers, first responders are some of the most at-risk individuals for mental health challenges right now. And so we did a webinar for them. And
now, was this for one of their divisions? Was it for corporate?
I believe it was corporate.
Okay.
And they had like 600 or 700 employees.
Oh, wow.
I think it's for Tennessee.
Mm-hmm.
Yeah.
Okay.
Yeah. So
what are some of the key things that you talked about that others might be, if we have listeners at other companies and this sounds, interesting to them, help them understand maybe the kinds of things that you can talk about and cover in that kind of a situation?
Well, it's interesting. The thing that I get asked about a lot is mindfulness. I did a presentation for my sorority at the University of Tennessee, and they were most interested in mindfulness because we hear about meditation, we hear about staying in the present moment, and a lot of people are just really looking for tips on how to get out of that place of worrying about the future and just living in the present and enjoying that. And the common tips that I give include like going outside for a walk, connecting with nature, breathing, just sitting in a quiet space and breathing in and breathing out. And it's very simple.
I just did that while you said it. I'm like, yeah, I need to breathe.
You breathe in for 5 seconds, hold it, and breathe out. And it brings down your blood pressure, it calms your heart rate. It's just little techniques like this. And the funny thing is that these kind of wellness tips, in implementing them, do not cost companies a lot of money. They really don't. It's the recognition of the mental health challenge and the awareness and addressing it that is so important. So speaking about it, naming it, and addressing it is what's critical.
That's great. So in those sessions, is there storytelling that happens in those as well? Do you incorporate that as part of your toolkit?
Yes, actually, as part of the toolkit, I have a checklist that CEOs should do, and it really starts at the top. And I encourage CEOs to talk about their experience with mental illness, because when employees see that their top leader is willing to talk about maybe his or her fears, maybe his or her loved ones that have had mental illness, then all of a sudden they're more likely to talk about it too and see that it's okay to discuss it. So storytelling is very important.
Along those lines, you had shared a story with me also about when you were at NAMI, Florida, and all of a sudden, kind of randomly, dollars started sort of flowing into the organization. You guys were like, what's going on?
Yes. I noticed our PayPal account was all of a sudden getting bigger and bigger. And I looked to see what was going on. And there were donations ranging from $25, $100, $500 from a particular corporation. And I think it was in Michigan. And it was in memory of a young man. And I couldn't quite figure out what was going on. So I called the company headquarters and pieced it together. And it was a young man from Florida who had died by suicide. And his father was a corporate executive. And corporate leadership and the employees were just so upset about what happened. And they decided to all get together and give money to NAMI, Florida, in the name of this man's son.
That's amazing.
And it was, and I looked up the obituary in the newspaper, and it was heartbreaking. He was 16 years old.
Oh my gosh.
And it was just,
wow.
But it was very moving because I knew that those dollars would go to help other families cope and other people learn how to address their mental health challenges.
And it's so interesting too, because, when something tragic like that happens, at work to someone you work with, you want to be able to do something, right? You want to be able to help. And that's what those donations, it probably helped them feel better and process a little bit of their grief or what they were going through.
Definitely.
So that's great. It's really cool too when that just happens organically.
Yes, definitely.
Because you're always trying to raise money and awareness and drive policy, probably in your role. Is that accurate? How is NAMI Tennessee funded?
We have some contracts with the state for offering classes, grassroots training, advocacy training, support groups. We have support groups for individuals with mental illness, as well as a separate support group for family members, because it's a family disease, and they need to learn how to cope as well. So, and then beyond that, grants, donations, sponsorships for events, and then to a lesser extent, membership.
Gotcha. And then, do you do a lot of different partnerships with public and private organizations? I'm just curious, do you have like relationships, for example, with like Blue Cross Blue Shield Tennessee or United Healthcare or other, healthcare companies? I'm just curious how those relationships are leveraged, because, it's interesting. You said HCA reached out to NAMI Tennessee. So I'm just curious what other kinds of partnerships exist.
Yeah, sure. So my boss, Jeff Layden, is more involved with those kind of partnerships. But for example, we started having a Facebook Live on Mondays at 2:00 on our NAMI Tennessee Facebook page. And the way that was kicked off was underwriting from United Healthcare. So that was a huge kickstart for us, because now we've got 3,000 to 5,000 people a week who watch that.
Wow.
And it's really well done. Yeah.
What are those?
So it's just a Monday Facebook Live event. It's moderated.
Anybody can join.
Oh yeah, anybody can watch, and we've got national speakers that come in on. Oh gosh, trying to think of the different topics. Anything ranging from childhood mental health to different types of treatment, just trending topics.
That's awesome. We'll have to include a link to your Facebook page for those in our show notes.
Definitely. And, we're definitely looking for sponsors for our we're going to have a virtual walk again this year. Sponsorships can take on different forms, like with underwriting for the state convention, different programs, things like that.
Mm-hmm. So one of our clients here at FWOCO has a annual healthcare summit, the eMeds Healthcare Summit. And this past fall, they had a great panel on mental illness, and it was called The Tipping Point of Mainstream Mental Health. And Tom Sang, who's an MD, was one of the panelists, and he was an internist as well. And he said 60% of his primary care patients have some sort of underlying mental health issue that needs to be treated, and that it's just such a critical access issue. And I want to get to in a minute, there's been a huge influx of dollars into mental health technology and apps and things like that. But, at a more sort of foundational level, do you think that maybe in the wake of COVID-19 and the pandemic, do you think that we're going to start to get any closer in this country to changing the way that mental health services are delivered? And in some countries, they're just a part of primary care, but that's not the case here. Is that something that NAMI is working on, or that you think is maybe on the horizon?
I do. So, for instance, like in England or in many European countries, mental health is part of primary health care, and the primary care providers will give a mental health screening, just to check and see your alcohol use, or are you sleeping too much? Because those are two signals, two red flags of something that could be more serious about your mental health condition. So we do know that the Biden administration has pledged more money for behavioral health, substance abuse. And so we're really glad to see that. I find that a lot of primary care providers, especially older ones, have just not been taught how to do that, just a quick 10-question screening for mental illness or mental health challenges. And they don't know where to go for resources. I'm hearing that the nursing schools and medical schools are incorporating that more and more into the curriculum. And that's where it starts, is teaching the up and coming medical professionals that this needs to be very much a part of screening for mental health conditions as you would check blood pressure and vital signs.
It seems so simple, but
It does.
It's just not happening that way.
Well, the way that healthcare has been delivered is from the neck down. It's like you have other parts of the body, and then anything that happens in the head, the brain is different. And now what we're seeing is emerging and treating the whole person. And what I would like to see, and I'm a big proponent of, is the holistic medicine, mind, body, spirit. And that's where your mental health is also very much intertwined with your physical health.
Mm-hmm.
And we know that heart conditions, high blood pressure can very much be influenced by your mental health condition, stress and anxiety. So it's important to treat all those as one person.
Wellness, as you said earlier.
Wellness.
Just overall wellness.
Mm-hmm.
So to that, I mentioned earlier, there's reports out there about the number of dollars that are flowing into, I guess, access points and maybe solutions for mental health. And, mental health being, as you've described it, kind of this bigger, broader thing. And according to the research, there's a record $2 billion in equity investment that went into mental health in 2020, which I can only imagine is going to lead to some pretty significant solutions, hopefully, as part of telehealth, different applications. I don't even know. I can't imagine all the different ways that maybe that money can drive innovations there. What do you think about that? Do you track that at all? And do you think that, sort of like digital access is going to be super important?
I do. From a recovery standpoint, it was interesting after the pandemic started, you had people who were no longer able to go to their AA meetings or their NA meetings.
Right.
And yeah. So a lot of them went to Zoom. And so what I started seeing is a proliferation of apps for recovery, like tracking your recovery and connecting you with other people, other networks of people who were in recovery. That networking became really important. But then the challenge there was that NA and AA have, the anonymity. And so suddenly you're on a Zoom call where somebody could potentially record you.
Oh,
and
what are they doing about that? Do you know?
My understanding is that, I think you can limit the recording options for people, but they're continuing to have the Zoom calls for sure. And I don't know, I think some of them have started meeting again with social distancing, it just depends on the city. Yeah, but that was a challenge. So those recovery apps, I think that might be a place, for investment for sure.
There's also, been a lot of media around online therapy provider Talkspace. Mm-hmm. They had a $1.4 billion merger with an investment firm, and they say that 80% of behavioral health can be done remotely. So I think that's interesting. I certainly, just personally, I downloaded the Calm app, and that's a pretty cool app. And that's a lot of sort of like mindfulness, is on there, but there's just different resources, and there's soothing music and soothing content and things like that. And I have heard of a lot of people who have leveraged apps like that. I had this great opportunity to go to a yoga and mindfulness retreat through a studio out of Boulder. And it's Taylor White Moffat, and she's Amazing. And so much of that was just that high level notion of being present in the moment and breathing, like you were talking about.
Right.
And when you start to do that, I think you do start to discover all kinds of things that maybe you didn't realize were there.
Right.
So I'm rambling a little bit here, but I'm excited about the investment that's, the money that is going into solutions around this. And, even before that, I had gotten calls from a couple of different entrepreneurs that were really looking to develop. They were in the mental health space, and they were actually, clinicians, and they were working. It was here in Nashville, but working to come up with mobile solutions, and what we're now understanding is more like sort of telehealth solutions. But there were all kinds of issues that were getting in the way in terms of regulations and being licensed,
Oh, right. Yeah, the whole telehealth
crossing
debate.
state lines. Telehealth is kind of opening that door,
Sure.
to primary care provision, as well as hopefully it'll open the door, for the provision of mental health services as well.
Yeah, definitely. Definitely. I mean, I know telehealth legislation has been debated federally and on the state level. And, there's, in some cases, there's turf wars. Some providers don't want providers from other states coming in here and taking their patient.
Right.
But we really are in a new paradigm. Now, this has been a shift because of this pandemic. We now see the technology has just opened so many opportunities for people to connect and get help. The biggest thing I see as far as telehealth is providing an opportunity for people to realize that they're not alone. There's so much isolation that comes with mental illness. You feel like you're the only one who feels this way, or you're embarrassed or ashamed. And so having somebody to talk to about this without judgment and, without having to worry about what they think is a really big thing for the individual who's suffering.
That is so true. Does NAMI Tennessee have your kind of 2021 legislative agenda mapped out? Is that something you're working on? What's on the horizon for the kinds of things that need to move forward and happen?
Yes, I'm literally working on that this week.
Oh, excellent.
So, yes, one of the things that our organization is involved with nationally and on the state level is the connection with law enforcement and educating them on how to respond to an individual with a mental health crisis. And this is, we have a program called Crisis Intervention Team Training, and it's a program that started in Memphis 40 years ago.
Oh, wow.
And it started with it wasn't quite as bad as the George Floyd situation, but it was a shooting of a man by some officers who was in a mental health crisis. And the community got together and said, we've got to do something. We can't have law enforcement responding in this way. And they developed this CIT program that is now global. And like I said, started in Memphis. And at NAMI Tennessee, we've got one of the founders, Sam Cochran, who's a consultant. We have a statewide CIT coordinator.
Oh, wow.
And we help communities bring together stakeholders, law enforcement, and mental health providers to develop ways to improve situations when a person's in a mental health crisis and how to get them help instead of handcuffs. So
and has that bubbled up, coming out of 2020 and the unrest and, defund the police and everything, all the awareness that has been driven around these horrific scenes that have played out in front of our eyes.
Right. It just underscored the importance of community training, actually, of de-escalating these situations and how to get people the help they need. So, we'll be asking for money from the legislature this year and to help law enforcement agencies, police departments, sheriff's departments, send their officers to trainings. So, because it's so important, it's just critical right now. And then, another thing that we're going to be talking about is walk-in centers. So, typically, police officers will take a person in crisis to a drop-off center, but there's only like 3 or 4 in the state. So if you're in East Tennessee,
are they in the major metropolitan areas?
Yes. So if you're in Northeast Tennessee, you might have to drive a few hours to go to one. So, and when you're in a crisis, you need that service right then and there. And to have a drop-in center really takes the pressure off the emergency rooms because they're the ones that are responding to these crises. So, yeah, we'd like to see more money into these drop-in centers.
Do you envision that Governor Lee is going to be an advocate and a partner in these initiatives?
Yes. We actually had a meeting with him at the beginning of the month, and he told us he would like to do more. He's going to do what he can, obviously, with the dollars that he has. We're all bracing for, what the budget's going to be like because of the drop in revenue for our state. Mm-hmm. But his commitment to mental health is there. And really, the state budget held firm. Like there were no cuts to the mental health budget in the state, which we were really pleased about. So if we can just hold the line, that would be great. I mean, obviously there's more work to be done, but the most important thing right now is to just maintain and not go backwards.
And will you be bringing some of your storytelling to that effort this year?
Yes, I'm actually doing a storytelling training on February 17th. We're not having our day on the Hill we're having it, but it's going to be virtual because all the days on the Hill have been canceled. So we're going to have a rolling event. It's not just a moment, it's a movement, so they say.
Yeah.
And instead of having one day in the Hill, I'm going to have different trainings for people over the course of several weeks on different issues and different topics. So people think that they can't talk to legislators because they don't know anything about legislation or budgets. And what I tell them is they're actually the experts on mental illness because they've lived it. And that makes them credible and the expert.
So it's just tell your story, just be authentic, like you were saying earlier.
Yes. Now, I also teach them how to be cognizant of time and respectful of time because some of these stories can, get a little long. But basically, you can hit the highlights in 2 or 3 minutes.
Mm-hmm. I wonder if this opens a door of opportunity for you. Like you would be able to record this and, have anyone go in and maybe get access to these stories on a virtual platform in a way that maybe you wouldn't have had that, if you actually were in person for a day on the Hill. Is that going to be something you're maybe going to make available?
Yeah, definitely. So I've been kind of bombarded with emails from organizations that want to do like the online platforms for reaching out to legislators. And we do have one that we're going to be using, but I think story collection, story banking right now is huge because we don't have access to legislators right now. Like I, as a registered lobbyist, have limited access. The public has no access. They're going to let us come in for committee meetings, but, apparently there's no mask mandate at the Capitol. So a lot of people will not be doing that. So it's going to mean that letter writing is going to be more
old-fashioned letter writing. It still works, doesn't it?
So that's what I'm telling our people to do because an email can be deleted, but a physical piece of mail, it's a little bit, especially when you get a lot of them.
Right. Like,
an impact.
All of a sudden a big bin of 1,000 letters come in. You can't ignore that.
Right. So old-fashioned letter writing is going to come back.
And as you and I also know from our reporter days, legislators really listen when their phone is ringing and they are getting mail and emails and being bombarded on an issue. That gets their attention.
Oh, definitely. And legislative aides certainly keep a tally of calls that they get for and against a bill or an issue. They do listen. And, my concern is that because of everything that's happened, with the presidential election and then, at the Capitol a couple weeks ago, I'm hoping that people don't get disenchanted, that they realize that they can make a difference. And honestly, I think on both sides of the issue, people's voices, the people are feeling like their voices have not been heard. And so that's why I view my job as more important now than ever, is to make sure that people are heard when it comes to their challenges with mental illness, because we need to have some policy changes.
Absolutely. I've got a few stats. I'm just going to read them out because that's kind of a good segue for it, I think.
Okay.
So according to our research, 1 in 5 U.S. adults experiences mental illness each year.
Mm-hmm.
Is that the one you said is now 1 in 2?
Yes.
Amazing.
Mm-hmm.
An average of 11 years passes between the onset of mental illness symptoms and treatment?
Yes. A lot of times symptoms will show up around age 13, but they get blown off as typical teenage behavior like isolation, withdrawal, loss of interest in hobbies.
Mm-hmm.
And so by the time they're a young adult, they're already into their mental illness and they have been treated for it.
So it's just kind of getting worse.
Yeah.
It may be manifesting in all kinds of ways that
Right.
no one's really clear that it's actually tied to some underlying issue.
Right. That's why you see these young people, especially young men in their early 20s, having psychotic breaks.
Wow.
Yeah, because it hasn't been treated 11 years earlier when it started showing up as symptoms. Sometimes it's rebellious behavior. Sometimes, it's aggression. But when actually the root cause is a mental illness.
And yet another statistic is 60% of U.S. counties do not have a practicing psychiatrist. Have you heard that figure?
Yes. We're lucky that we have a pretty good group of members across the state of a coalition, behavioral health coalition, and that workforce issue is critical. We talk about that quite often, and we've got to get more mental health professionals through school and out into the communities.
How does that happen? Because another statistic I'm looking at is that the number of mental health providers has increased about 23% from in the last 4 years.
Mm-hmm.
But it's still not enough, as you say. So is it just about helping people see that as a career path and a need?
I think so. It's also about loan forgiveness programs. So you
yeah.
school and you work in this community for a certain number of years, and we pay your student tuition.
Yeah. Hey, it's working in a lot of other areas. Why not work for this profession?
Right. And in Tennessee, it is challenging in some of the rural areas because mental illness is often not discussed. And in some areas, mental illness is looked as a sin or a weakness of character, a defective character. And so there is a lot of education that needs to go into that and teaching people that it's a disease. It's not a sin.
Wow. When you put it that way, it's compelling and sad.
Yeah.
So apparently there is, however, a new mental health emergency number, I think, that's being developed. That's sort of the equivalent of 911, but it's not going to be going live until, I think, they're projecting 2022. Do you know anything about that?
I do. Our NAMI national organization was involved with that on the federal level. It's 988.
Okay.
And so it did pass Congress, I think, in the spring. And now what happens is states have to enact legislation. I think some put in place some fees, maybe like communication fee. And right now, I haven't seen any bills being filed to do that yet. We've been talking to the Department of Mental Health and Substance Abuse about that. Not really sure what needs to be done here quite yet. So, but it is something that we're watching.
And do you think that is that's almost sort of, it kind of falls into the, kind of helping try to keep folks that could be getting mental health treatment out of the ER, for example, or they're not calling 911. And so even, it's kind of de-escalated. If it goes through a 988 number, maybe it's de-escalated on the front end. Is that kind of part of the goal there as well?
Yes, absolutely. So people can get the help they need before the situation escalates. And you can imagine the diversion of calls that will now take place that would go to 911 will now go to this 988 number. And so then that sets in motion a whole different set of providers and support as opposed to 911, which is more law enforcement response.
That makes so much sense.
Mm-hmm.
I'm excited to see that come to life. What happens if you dial 988 right now, I wonder?
Yeah, it's not set up in Tennessee yet.
So nothing happens.
I
Okay.
don't think so.
Okay, so stay tuned on that, right?
Yes.
Awesome. Well, what are some burning issues on your mind that we haven't covered that you think would be important for our listeners to know about or get engaged with?
I think children's mental health. We need to be aware that our children are. I mean, we're all in a very unique experience now with the pandemic, but they don't have the skills and the tools to cope yet. And, I think it's important to encourage children to talk about their feelings. There are, a number of good resources online. If you Google like parent resources, pediatric mental health, there's some good tips out there.
Mm-hmm.
So, it's important that our children be remembered during this time.
So important. I feel for the kids.
Yeah.
So on that note, can you tell us and tell our listeners if they want to get in touch with you, if they want to get in touch with NAMI Tennessee, they're looking for resources, what's the best way for people to do that and to reach you?
Yes. So the easiest way to reach me is at advocacy@namitn.org. And you can go to our website at namitn.org and see what we're doing here in Tennessee. We actually have a whole page dedicated to mental health and law enforcement. And then you can go to our parent organization, NAMI.org, and it's just a fabulous resource. It has information on what the symptoms are for different mental health conditions, how to navigate, getting help, the effects on loved ones and what families go through when a loved one has mental illness. It's really geared towards being a resource for both the individual and the family member affected by the illness.
That's awesome. How long has NAMI been around? I imagine, the resources are just, broad as well as deep.
Yes. NAMI has been around for 40 years, and it started with a group of moms in Madison, Wisconsin, sitting around a kitchen table saying that they're frustrated that they couldn't get help for their children with mental illness. And from there, it grew nationwide. And
the power of moms. I love it.
Yes, they were called NAMI mommies.
NAMI mommies.
Yeah.
That is wonderful and kind of full circle, maybe even to where we are today, and moms continuing to come together around issues. And unfortunately, like you talked about with Parkland, so often it does take a crisis to finally get some of those voices heard. So I continue to talk about there's so many silver linings from the pandemic and from everything that we experienced in 2020. And I think certainly shining a light on the need for us to approach and fund mental health access and services differently. Hopefully that will, history will look back and that will be a silver lining for mental health as well.
I think so. We're at a pivotal point, and I'm very happy and grateful to be part of it.
Well, good luck with all of your efforts and with your legislative agenda this year. I'm super excited for you.
Thanks.
And hopefully Tennessee will continue to serve as an example. It sounds like that CIT, is that the program that came out of CIT? Sounds like a national model. So let's keep on bringing solutions that others can follow. So
yeah.
Thank you so much. I've loved this conversation. It's so good to reconnect with you. And I'm so glad you're back in Tennessee. Welcome home.
Me too.
And we look forward to following NAMI Tennessee and your good work.
Oh, great. Well, thanks. Thanks for having me. I enjoyed it.
That wraps up this episode of How It's Done. My guest today has been Alisa LaPolt, Policy and Advocacy Director of NAMI Tennessee. And we have talked about the role and power of storytelling in mental health. Thanks for joining us. That's it for now. Thanks so much for listening. We're looking forward to keeping great conversations coming your way as we grow this podcast. There's even more great content from our conversations on our blog. be sure to check it out at growwithfuoco.com. That's grow with Fuoco, Fuoco.com. Stay tuned until next time, and no matter what, stay curious.